you go live on YouTube, and it has you like take a thumbnail, and it goes like 3, 2, 1,
oh,
and
you're
then
live. We're live. All right.
Okay, YouTube, we're up and running.
Hi,
Thank
YouTube.
you. Hello, YouTube. Welcome.
Technical issues, but
the
we're here now.
Show.
Better late than never is the saying.
Perfect.
Oh, look. Okay. All right. We're up and live and running and all that stuff. So, sorry about that. That was a little segue, or tangent or something like that. But back to talking about the nursing process.
The nursing process.
Okay.
So, yes, on Monday, if you were here with us on Monday, we talked about a nursing profession course where I didn't know the answer because I didn't have that course. But come to find out that the member wasn't asking about a nursing profession course. Well, I think it was, maybe that's what it's called, a nursing profession course, but it's actually about the nursing process. So, we have videos on the nursing process on YouTube. And so she was wondering how to pass the nursing profession course. It's about the nursing process. Really, the nursing the nursing process course that I had in nursing school was where you learned the head to toe assessment, you learned the nursing process, all those things, care plans and things like that. So that is what I would recommend you focus on. And we have those videos up on YouTube. So Nursing SOS, nursing process, you can Google that or put that into YouTube, or Nursing SOS care plans. So just go to YouTube and type that in, Nursing SOS, nursing process, or Nursing SOS care plans. Do that. Type that in, and it should pop up there for you. We've got some fantastic videos on nursing care plans. I can literally walk you through step by step how to write your nursing care plans. So awesome. So awesome. So, okay, and then can I jam on that too? The second question from members. Are these the only two questions we have this morning?
Those are the two questions from our members, yeah.
Okay.
Yeah. So,
do you have any videos or cheat sheets on acid-base balance and homeostasis? Yes, we do. So acid-base balance, we have all the ABG stuff up on our YouTube channel. There's actually a whole playlist for it. I wonder, Matthew, can you post that playlist? And then also, if you go to
ABG.
NursingSchoolOfSuccess.com/ABG. I wonder if we have that playlist. Maybe I actually didn't put that up there. Oh. There is a whole ABG series up on YouTube. So Nursing SOS ABG, like just go to YouTube, type in Nursing SOS ABG. Yes, we do have those for you. And then if you're a Nursing SOS member, we have a whole cheat sheet database for you inside the membership community. So you can go check that out. You click on cheat sheets, the whole database.
So you added that database. For those not in the membership, you can go to NursingSchoolOfSuccess.com/ABG, and you can get the cheat sheet that way as well.
Yes. Sunshine Dalton. Good morning. So we don't post links on Instagram. Instagram is not very link friendly. So Matthew posts all the links on YouTube during the live. So he just posted, if you just go to NursingSchoolOfSuccess.com/ABG, that's the link for that ABG cheat sheet. So that is on the YouTube chat. If you're on YouTube, it's in the YouTube chat. Check it out. There you go. Perfect. Alrighty. So those are the two answers for that. So that is, I noticed that. Yeah. Instagram's not very link friendly. So here you guys for Wednesday. I decided to do something a little bit different. We're going to do two things today. I'm going to do my little spiel about nursing textbooks and which textbooks are going to save you a ton of time in nursing school. So I'm going to jam on that for a little bit. And then while I'm doing that, you can post your questions in the chat wherever you're at, Facebook, Instagram, YouTube. Post your questions in the chat, and I will answer as many as I can after I finish my little spiel.
After a little spiel. So definitely, guys, you can ask any question that you want in the comments. I will try and capture them all while Christine is talking about textbooks.
Hi, Lorelli.
And then we'll go from there. All right, great. Go for it.
Okay. So first thing I want to do, if you were here on Monday, we talked specifically about how to pass med-surg and how do you study med-surg when you have all of these textbooks. If you can see all these textbooks, I think YouTube and Facebook can see me. Instagram cannot. But I have a lot of textbooks over here. how do you pass med-surg when there are so many resources to look at? Now, I recommend that you constrain the information that you use during nursing school, or else you will go kind of bananas. So if you're in the Nursing SOS membership community, you are in a very nice, unique position because I do the hard work for you and our team does the hard work for you, where we condense the information for you and you can just watch a video. So you don't have to go digging through 15,000 textbooks to find the answer. You can just pull up a video and I will teach it to you. So if you're a Nursing SOS member, do that. If you are not a Nursing SOS member, here's what I recommend. I recommend that for pretty much all of your nursing classes, but let's talk specifically about med-surg right now. You need 2 resources. You need one textbook that is a high-level overview of the med-surg disorder. Then you need another textbook that is a deeper dive on it. So we're talking, when I say deeper dive, I mean like cellular level, chemical level. It like dives deeper into the pathophysiology and what you need to learn, what that disorder is. And then you need a higher level overview that's just like kind of a, bird's eye view down on that disorder. So here are the 2 resources that I was talking about on Monday that I recommend. The high level overview, I recommend this book, Pathophysiology Made Incredibly Easy. This is going to help you so much in med-surg and nursing school. It's a game changer for you. If you don't have the Pathophysiology Made Easy series, I mean, there's just a ton of them. This is fluid and electrolytes. Fluids and electrolytes. What else do I have? I have assessment, and this was actually my textbook that we used in nursing school. It was the assessment book. So cool. So it's so great. I mean, this series, really, when they say made incredibly easy, they mean it, made incredibly easy. So these are your high-level overview books. Now, is this patho book going to go deep into the nitty-gritty of what's happening in a med-surg disorder? No. It's a very bird's eye view. It's a high-level overview, what you need to know about the disorder just from a high level. Now, so that's the first resource I recommend for med-surg and patho. The second resource I recommend is this bad boy right here, which is the Merck Manual. The Merck Manual, this was not required reading for our nursing school, for my nursing school, but it was recommended to me by an instructor as we were writing our research paper. So if you are writing a research paper or something like that, where you need a deeper dive into pathophysiology and med-surg, this is the book you are looking for. It is amazing. It's divided up into all of the different med-surg disorders. Pericarditis, tumors, particular types of tumors. It has like pediatric section. Let's see, lymphomas, transplants, all the, autonomic nervous system, asthma. It's all there for you in the book. So this goes in the deeper dive on the cellular or chemical level of what's happening with the pathophysiology. So you take these 2, here's how I use these. You take these 2 books in tandem together. You use them together. This is the one that I would go to first, and I would read this and get a general idea of what was happening with the patho. Then when I understood that, the general idea of what is kind of happening with it, this is the one that I would go to next. Okay, now that I kind of understand a high-level overview, now I'm going to go deeper with it. So those are the 2 resources that I recommend that you have. Pathophysiology Made Incredibly Easy. This is, there's really no author. It's just Lippincott. Yep, Pathophysiology. If you just go to Amazon, I'm sure Pathophysiology Made Incredibly Easy. There you go. Merck Manual. I don't know if that's on Amazon. I hope it is. Okay. That's for med-surg. Now, let's talk about fundamentals.
Woohoo! For all those people asking about fundamentals and the best fundamental book,
Boom!
This is it.
Hello. And if you are just joining us, good morning. My name is Christina. This is Matthew.
Hello.
I am a nurse. People ask me that a lot.
I am not a nurse.
He is
People
not.
ask me that a lot.
So actually, this is a funny story. I just realized, just the other day, actually, that I never put RN after my name. And I never say in our YouTube videos that I'm a nurse. Like, ever. So funny. Which is totally fine with me. But I was like, people message us on the YouTube videos and they email us and wish me good luck on my final exams in nursing school. And I was like, oh, that's so nice of you. I took them 3 years ago, you know, for however many years ago it was now, you know, so it's kind of funny. Not a big deal. I just think it's hilarious. So by the way, I am a nurse and I did pass nursing school. So I can help you with it, which is super fun. So, fundamentals. Let's see. Oh, yeah, okay. So you got the Patho video, Patho book already. So these 3 resources for fundamentals are going to help you so much. Do you guys want a screenshot? Okay.
Ooh,
let's do some
time.
screenshots. Okay, so here's what we're going to do. I am going to hold up these books. I'm going to hold up these books for like 2 seconds. And while I hold them up, please screenshot it so you don't forget it. Now, I understand that like some of you, I think YouTube is the right way, but Instagram and Facebook, you are probably reversed.
True story.
So just try to reverse it on your phone. I don't know, or try to read backwards. So okay, I will hold these books up. You make sure, like on your phone, screenshot it as I hold it up. Cool? We all good? All right, here we go. This is the Nursing Diagnosis Handbook by Ackley and Ladwig. Okay? Screenshot that. Nursing Diagnosis Handbook by Ackley and Ladwig. This is a must-have. I'm going to hand them to you.
All right, I got that one.
Thank you.
All right.
Now, this is Nursing Assessment made incredibly easy. Cheese. Okay, next. Fluids and electrolytes made incredibly easy. Cheese. Alrighty, and then I'm going to throw, just since we're doing screenshots, this is the Saunders Comprehensive Review Guide to the NCLEX RN Examination. Screenshot this, please, because it's going to save you so much time in nursing school. So much time. So much time. Okay.
For these made easy, someone did ask, is there a made easy book for PN or RN, or does it even matter?
Oh, LPN.
Is the made easy book for PN or
RN?
practical
nursing or registered nursing. I don't think that they divide those two up. I think that they wait, was it? Oh, is it for practical nursing or registered nursing? So this one is for more registered nursing. But you might actually, this is going to be more for registered nursing. Some of the things in here will apply to an LPN program. Some of them. Okay, I'm flipping through it just to be sure. Yeah, this looks more like an RN book to me. Because I don't even remember, because I haven't even looked at it for like a few years since nursing school. Okay. This is more of an RN program book because it is the nursing assessment. The RN nursing assessment. Now, the difference between an RN assessment is an RN not only collects data, but also interprets data. Whereas the LPN role and scope of practice will collect data and then relay that data to the RN for the RN to interpret and analyze. So that's the difference. Now, this book might help you in your LPN program because it has it talks about a lot of data collection, but also it will talk about kind of that analysis as well. So just know the difference between those two. All right, now next book for not only fundamentals, but just always. Please get it now and please keep it forever. The Davis Drug Guide. You've heard me talk about it again and again and again.
Technically, Davis's Drug Guide.
I never call it Davis's.
Davis's Drug Guide.
I've been calling it Davis Drug Guide for my entire life and refuse to stop. Screenshot. Get this book.
Thanks, Davis.
Saves your life. Davis Drug Guide. Davis's Drug Guide.
Also, some
Oh,
people
man.
ask, get the book or get the app. We recommend both.
I recommend the book.
You can't really tab. You can't really tab. Some ASMR for you guys.
This is the newest. What's that?
ASMR?
Yeah.
Oh, it's like adding sound to things. So
Oh.
doing that. So anyway, yeah, you can't really tab apps. So
you learn something new every day.
There you go.
This is the new one. Well, actually, when I say new, I mean like I bought this like 6 months ago, and I think there's even a newer one now. So this is the 16th edition. There's probably a 17th. This one's purple. This one was old. It's green. So get the newer one. Make sure you get the newer one because medications change all the time. So there's that. If you're in fundamentals, you probably have this book, Nursing Fundamentals. Haven't looked through it a ton. I didn't use this one in nursing school, but it looks cool. So there you go.
Purple as well.
Purple as well. Okay, and you guys know always what I say. Are you going to read this entire book during nursing school? No. No. So, go to YouTube, type in Nursing SOS, how to study. I will walk you through how to study in nursing school so you do not have to read this entire textbook. Oh, because that would be a bummer. Matthew, we have that playlist actually for study tips, right? Can we post that in the YouTube chat, please?
Study tips.
We have a full series playlist on how to study.
How to study playlist.
How to study playlist.
There you go. Okay, I can do that.
Yeah, so there's that. Okay. That's
Okay.
a lot of text.
My program is concept based, and we have been assigned so much reading. Would these textbooks would these books supplement other books, or could we use these for more concise reading?
When you say so much reading, what books are you using in your program? And more specific to that, are you in a HESI or an ATI program? And do you have the ATI textbooks? Can you please tell me that before I answer your question? Here's why. If you are in an ATI program, I recommend that you focus reading the ATI textbooks because it goes with the program. Same thing with HESI. I recommend that you do the HESI online slides. It goes with the program. And then these books were not required. Well, this one was required reading for my school. Like the other Made Incredibly Easy ones were not. They are supplemental reading to make it easier to understand, because like this textbook is going to say it one particular way and you might not understand it the way this book says it. And then you go to this book and you understand how this one says it. Yes, we have ATI books. See, that's why I clarified. I would definitely focus on reading the ATI textbooks and using these as supplementation. My answer might be slightly different if you are in a school like mine, whose required reading was like this book here. So if you don't really want to read this book, that's fine. The information in here will still be the same as the information in here. ATI just tends to condense it down pretty nicely for you. So I would focus on that, using this as supplementation. So you can do that. You can do that here too. Read your fundamentals book, use this as supplementation. Because this, I'm using this as an example of like required reading, because this is a lot of your guys' books, right? Everyone has that book nowadays. Yeah, I would use them as supplementation. Now, this only goes for if you're not a Nursing SOS member. If you are a Nursing SOS member, I do this for you. So our team condenses the information for you. We put it in a video, so you just need to watch the video. If you don't understand fluid and electrolytes, that's fine. You don't have to read this book. All you need to do is go to the membership community, click on the fluid and electrolytes course, and I will teach it to you. It's the same thing. So that tends to be a lot easier if you are a Nursing SOS member. Yay. Okay, so let me talk about, so those were more fundamentals books. Can you hold this, please? Thank you. So those were all the screenshots. Hopefully you guys got the screenshots. Now, let's talk about this one. This is a care plan book, Nursing Diagnosis Handbook by Ackley and Ladwig. I cannot tell you how many times I have said that in my life on our YouTube channel and all the places. This book is, if I had to choose 2 books that I would get in nursing school, it would be this one and this one. If I had to choose 2 books, it would be this one and it would be this one. Screenshot! Maybe that helps. There you go. So this literally writes your care plans for you. I'm not kidding. I have done a few videos up on YouTube about how to use this book, and I hope you go back and watch it because it's so good. But basically, they tell you all of the signs and symptoms that you will see. They give you your patient goals for you. They give you the risk factors. They give you the nursing interventions for it and the rationale. It writes your care plans for you. Not kidding. Not an exaggeration. So definitely get this book. It'll change your life. Nursing Diagnosis Handbook by Ackley and Ladwig. Now, we talked about the Davis Drug Guide. You need that one for pharmacology and learning meds. You will also see these all over your clinical floors, all over everywhere. Now, let's talk about this one, the Saunders Comprehensive Review. Oh, I guess it doesn't say guide. Saunders Comprehensive Review for the NCLEX RN examination. Now, they do have a NCLEX PN examination or NCLEX LPN. I don't know what exactly it says, but it's practical nursing. They do have a practical nursing edition. At least they did before. So I'm pretty sure they do now. They do have one of those. So this book here is a nice study guide because all of the chapters here have, it's like one big study guide for you. One big study guide. And then at the end of each chapter, it has practice questions for you to go through. So each chapter is kind of broken up like fundamentals, maternity, pediatric, and then it gets into like the med-surg disorders, cardiac, respiratory, neuro, then mental health, and then there's like a comprehensive exam in the back, all the practice questions. So that is why this book is amazing. It's both a study guide and practice questions. There you go.
This looks like the 6th edition.
This is the 6th edition. I think this is the most recent one.
It says here, Christina, I have the 7th edition. Is that okay?
Yes, because that's the newer one. 7th edition of this one? Yes. This is the 14th edition. This is the 16th edition. So you would probably want the 17th edition or something. Yeah, just make sure you have the updated edition for this one. Ooh, here's a question. When did the 17th edition of this book come out? Can anybody tell me?
7th edition of that one?
Or the 7th edition. Yeah. When did the 7th edition book come out for this one? You have the 8th edition for Saunders. That's even better.
The bigger the number, the better.
The bigger the number, the better. And here's why. I don't want to scare anybody. I don't want to scare you, so please don't get scared about this because it's actually not a bad thing and it's not a big deal. Don't freak out. But the NCLEX is changing and it's totally fine. It's totally fine. Don't freak out about it. The NCLEX is changing in a few years. And so the NCLEX practice books that you have, you will want to make sure you get the updated edition that reflects the changes that are coming to the actual NCLEX exam. Okay, so don't freak out about it. It's totally fine. It's going to be fine. I promise. But just make sure that you have the updated book. Yeah.
That's the one that you went through?
This is the one that we, well, no, I think this is one of the later editions. I don't know. I forget now. But yeah, this is one that our school recommended / used.
Okay. So the latest sounds like from Ashley. Latest is
thanks, Ashley.
8th edition so far.
That's the latest that we have.
Unless someone has a 9th. Anyone out there with a 9th running around? Mm-hmm. Okay. When are they changing the exam? Do you know?
When are they changing the exam? They said the earliest, I believe, was 2023. So 3 years.
Okay.
2023 at the earliest. So if you're just starting your nursing school journey, you may or may not have a new NCLEX exam to take, which is fine because they have given schools now 3 years to prep. And so the change is actually, this is kind of funny. We've gotten a lot of nursing students that have been saying, oh, wow, Christina, our school changed. Now we're doing more case studies. That's why. Because the NCLEX now is moving more toward a case study based exam. And so we're now seeing the transition in nursing school to nursing schools using more case studies and being more case study based. So that's why I say, don't worry about it, because your school is going to prepare you for it. You know, the books are going to adapt. You know, it's fine. If you're a nursing SOS member, we do the critical thinking for you anyway. Like it's the same, like it's fine. It's the same thing. So
for practical nursing, the exam has already changed if anyone is in practical nursing.
Oh, okay. So, there you go. Fun. Yep. Alrighty. So let's jam on some. I think that was all I wanted to go through for textbooks. Was that helpful, friends?
Yeah. To follow up, kind of textbooks adjacent related, how do I just study for fundamentals? Actually, a question from a little earlier, just 15 chapters in my first exam, so overwhelming, and my instructor seems to read the PowerPoints verbatim, which is not very helpful.
Mm-hmm. Yeah, no kidding. That is a question that we get a lot. So I wonder if could I like just I wonder if there's any like better way to say that. So I always recommend that you focus on reading the sections of the book that your professors talk about in class. Now, like, your instructors are always going to tell you to read the entire textbook, right? They're always going to tell you that. Always. It's always going to be in your syllabus. It's always going to be on your course calendar. They're always going to tell you, hey, you've got to read everything in the book. But it is not true. You can succeed in nursing school without reading every page in your textbook. You can. And not only should I say that you can, but like you have to. Like it's the only way to go, because here's why. This book is gigantic. It's huge, right? It's huge. So it's just, you can try. You can try for sure, try to read everything in the textbook, but you're setting yourself up for failure, because by the time you read all of this, you're not going to be able to spend enough time learning it and actually critically thinking about it. And when you get to your nursing school exam, your exam is not going to test you on just facts from the book. Your exam is going to test you on critical thinking and how you apply the information. And if you don't spend any time doing that or studying that or thinking about that, then you're not going to do very well in your exam. Like that's just the reality. That's just how it goes, right? You cannot read every single thing in this textbook and remember it for nursing school, unless you have like an eidetic memory or however they call it and are super good at memorizing things. Then that advice doesn't apply to you because you remember everything anyway. But for all of us, you know, out here that do not remember everything we read and have to study it, then, you know, just make sure that you spend enough time studying and critically thinking about what you are reading, because that is what they're going to test you on.
So a follow-up to that from a member.
Okay.
They're watching on Instagram. I don't know, CPRB 13. If I read that correctly, might not have. But anyway, follow-up to that and fundamentals. Their school is starting a new process where they test every week before the lecture. Any suggestions on how to get through the reading, since we literally are having tests before the lectures? Okay,
we did that too, except the test was on the lecture before. So can you tell me, what is your test on? Is it like a quiz before the lecture? So you have to like read things or whatever before a lecture because you have a quiz on that lecture before the lecture? It's like a, what do they call it? Like a
pop quiz?
Like a pop quiz or like a quiz, yeah?
A pre-quiz on the...
pre-quiz, yeah, something like that.
So what it sounded like, that's what it was. But yeah, you're right. When you went through, you did have a quiz, but it was on the previous lesson.
It wasn't a quiz, it was an exam. We had an exam every week. And it was on the previous lecture. So, yep. Hey, Sonia. So
Yeah.
true, reading the entire textbooks leaves very little time for actually studying the material. Absolutely. Amen to that, friend.
Yeah.
Yep. So yeah, can you clarify for me, please? If you know, the advice is still the same. If you are doing a lecture exam even before class, but it's on the previous material, the advice still stands. Same thing. I would say, yeah, I would even go as far as to say that even if you have like a quiz before your exam on that day's material, so like you have a test before your lecture that's on the lecture. Does that make sense?
That's what it sounded like. So yeah.
Okay, so if that's the case, I'm going to say my advice still stands. You have to print off the instructor's PowerPoints first, because oftentimes they give it to you beforehand. They give you, something, some kind of module, some kind of something is going to be in your syllabus that highlights the key competencies that you have to know. And I say that because it's an accreditation thing. Like, they give you these things. So that is what you're going to want to focus on before your exam for lecture. So if you have to take a lecture exam before your lecture class, then that is what I would do.
All right, good.
Go for it.
Lorelei from another member that's
Hello.
in YouTube. Hello. Was asking, are there textbooks for health and wellness? So that's all it said. So I'm not sure if you had any more insight or clarification on what that question is.
Textbooks for health.
Are there textbooks for health and wellness?
I'm pretty sure it's going to be in your fundamentals book. Whatever fundamentals book you use, it's going to be in here for sure, because it's going to be part of, like, I don't know, it might even be its whole section. Let's see. Health and wellness. Critical thinking in the nursing process, all the things. Yeah, I don't know. Self-concept, stress and coping, spiritual health. It's going to be in that psychosocial section. And it also depends on what you mean by health and wellness, because health could be, nursing interventions everywhere kind of thing. So yeah, it's going to be in your fundamentals book. I don't have like a particular resource that's like a book called Health and Wellness. Mm-hmm. Sorry. Yep.
All right. Moving on.
Let's do it.
Ready to move on? All right.
Yep.
Next question from Instagram. What should I focus on in mental health? How should I study for it? Sounds like they're a member. Are there any lectures for mental health in the membership?
Perfect. So mental health is going to be a lot of two things: flashcards and whiteboards, and compare and contrast. Mental health is quite a bit of memorization. You are going to be critically thinking to an extent, but a lot of it is memorization. Bye, Ashley. Thanks for hanging out with us today. A lot of it is just going to be memorization and comparing and contrasting the different disorders that you're learning. And then medications. Whole other side of mental health is medications. And so in the Nursing SOS membership community, we're releasing that pharmacology database for you, medication database, which is fantastic. So stay tuned for that. We've got a bunch in there already, and then we're releasing them as we get them done. So that is that. I also saw something about labor and delivery and postpartum. Is everything I should focus on in the videos inside the Nursing SOS membership community? Yes, we have a full labor and delivery course inside. Actually, it's OB maternal newborn. So we include newborn and postpartum there too. So that is all there for you. And I also talked about labor and delivery, I think on Monday, and then I also talked about it on the tutoring call yesterday. So labor and delivery or maternal complications and disorders, things like that, it's the same process that we follow for MedSurg: pathophysiology, signs and symptoms, nursing assessment, and nursing interventions. You have to know those 4 key things: patho, signs and symptoms, nursing assessment, and nursing interventions. So that goes for labor and delivery as well, and all the maternal complications that you will see. Sweet.
All right. Are our YouTube videos in the membership? Currently, they are not. That is on my to-do list. I am working through concatenating all those, putting that in a centralized place in the membership so it is easier for you members to find.
We've got a lot of members on today. Good morning, everybody.
Working on that members currently. So
yeah, so we are. That is going to be such a great resource for our members. So instead, you won't have to like go to our YouTube channel. as much or like search through our YouTube channel. We're actually going to organize our YouTube videos inside the Nursing SOS membership community, so it'll be a lot easier for you to find. That's what we're working on. So there you go. Sweet. And then also, yesterday, new for members, I posted all of our cheat sheets, all the like study guides and everything inside the membership community in one place. Yeah. So now when you go and log into your Nursing SOS membership community dashboard, that's a mouthful.
That is a mouthful. Yep.
When you log into your dashboard, click on cheat sheets. There is a cheat sheets course there for you that has all of our cheat sheets.
Yeah. So it's just a brand new course. Go ahead and on your dashboard, you'll see cheat sheets, and just go there. And all of the cheat sheets that we have available out for the public as well. But they're all there in one spot for you now.
Alicia says, yes, thank you for that. It's awesome.
All right. Great.
Awesome. Why is it so expensive to join the community? I love this question.
Related to that question, is the membership community open? So it is currently not open. Go to nursingschoolsuccess.com/join to join the waitlist, and you will be the first ones to know when it opens up again. We just closed. So we're only, our launches are only a week long. So when it opens again, get on it, because it's only open for a week and then we close again.
Yeah, and it's only open a few times a year. So next time it opens, make sure you enroll right away, because every single time it happens, people email us Friday night and Saturday. They're like, Christina, I can get in. Ugh. Okay. All right. Why is it so expensive? I'm going to challenge you on this and say that it's not, but failing nursing school is expensive. Whoa. Christina went there.
All right. Yeah, you can go there.
I went there.
That is fine. You can go there.
I went there.
Okay.
So here's the thing about joining any program to help you through nursing school, what have you. So in our membership community is fantastic, you guys, because not only I was just talking to a friend about this the other day. Maybe you do have an idea, because I get on YouTube and I like jam on it all the time. I am so passionate about your success. Like, no one cares about your success more than I do. Like, I hope you do, but like you and I care about your success so much. Like, that is like, I just live and breathe your success in nursing school. So our Nursing SOS membership community is not a place where you join and then you never hear from us again. Absolutely not. That is not what we do. Like, it is not a like join, DIY it yourself kind of thing. Absolutely not. So we are here every week, twice a week on YouTube, answering member questions. And then on Tuesdays, I also do a tutoring call. And members always have the ability to post inside our private Facebook group or email us anytime, and a nurse will answer your questions. So it's like you get so much tutoring to help you through nursing school to get your questions answered. It's unbelievable. So how much is a nursing program? Like average?
$2. No? All right. More than that.
How much is a nursing program? I think on the low end, like 12,000. On the high end, 80,000. Maybe an average of what? 40,000 for a nursing program. In the US. I don't know about like outside of the US, but in the US, maybe 40,000. Does that sound right, everybody? I don't know. How much is your nursing school? A nursing school, like to go to nursing school is like 40 grand in total. Maybe like 10,000 a year. I don't know. So something like that. Let's just say 40 grand. Man, if you take that number, if you pay like 20,000 to your nursing program and then you fail out, you've just lost 20 grand and now you have to start over. Rather, if you had joined the Nursing SOS membership community and passed your nursing school, you save yourself that money. Does that make sense?
That does make sense, yeah. So putting that in perspective, yeah, it's just the term expensive also is a very subjective term too. So it is just how much is success? Like, how much do you want to put on success? Also, how much do you want to put on your time when you can be doing things more efficiently and using your time for other things, being with your family or playing video games or whatever, what have you?
Playing video games.
Hey, video game time can be important to some people. So anyway, yeah, so I think that we want to make sure that the community is available to people and that anyone can join it and that it is helpful and beneficial. And we also want to put our focus and time onto making it better. Like Christine said, we just yesterday, we just added a new course and just put all the cheat sheets there. We're currently working on putting all the YouTube videos in there. So we are constantly improving it, and that takes time and effort too. So just putting that all in and just what is it worth to you? So by you saying it's too expensive or so expensive, then it's worth more, or it's worth less than the money that you feel that you want to give up to go be in it. And that's totally fine. That is completely up to you. For the people in the membership community, they decided that it is worth that much money to put in. So they go in, and we'll leave it up to the members whether they feel like they're getting it worth or not, but we feel like they are. So
yeah, we actually just the other day, I was just talking about this on Monday. One of the girls inside our membership community inside the Facebook group, she had posted, actually, I want to tell two stories. So that's one. She had used our planner, and she was like, Christina, you have no idea how much free time I just found. Like, no idea. And like, she like couldn't even believe she had found so much free time, which is exactly what we want. Alicia's saying it's totally worth it. I totally agree with you, Alicia. And then I think it was a couple weeks ago. One of our members, she's so funny. She emailed us, and then she posted it. She posted all those places in the Facebook group. She was like, you guys, she was on the monthly plan for the membership community, and then she upgraded to the year because you get 2 months free doing the year. And she's like, it's so worth it if you are not on the annual plan. Like, join the annual plan now. You get 2 months free. Like, she's like, this is so amazing. It's so worth it. So funny. Yeah, totally worth it. Totally worth it. So there you go. I hope that answers your question. And not only that, but like, I think it is, I totally get it. I totally get it. It's so scary to like join a new program or do something new, right? It's scary to like put your trust in someone. Like, you guys as members are putting your trust in me that I will help you through nursing school, right? But I tell you what, like, I'm here for it.
She will.
I am all in, man. Like I said at the beginning of this, no one cares more about your success than I do.
It's true
like
story.
That is, I mean, I like live and breathe your success in nursing school. So just my personal opinion, if you were going to put in your trust in anyone helping you through nursing school, count on me, man. I've got you.
Questionable. Put trust in Christina. Questionable right here. So
don't put your trust in Matthew.
Yeah.
Apparently, no. So good. So I'm glad you guys are here.
I did want to touch on another question that was asked on YouTube, kind of not really related to what we were just talking about, but you did bring it up, and I do want to discuss it because it is something that is important to talk about. Someone's just really worried. What happens if I fail my first semester?
Ooh,
will they kick
good
me?
one.
Will they kick me out of school?
Good one.
Do you want to address that?
All right, let's do this. So first thing I want to say, if you want more information on this, we have a whole YouTube video on what to do if you fail an exam in nursing school, which goes for like what happens if you fail out in nursing school. So go to YouTube, type in nursing SOS.
Fail
something.
Not that It'll nursing SOS failed, but put nursing SOS fail, and that YouTube will pop up.
It'll come up for you.
Yep.
So nursing SOS fail. And then, so when you fail an exam in nursing school, what is this? Where's the actual question?
It's right here.
What will happen if I fail my first semester? Will they kick me out of school for fundamentals? Okay, so if you fail your entire semester, there are a couple of different routes, and it depends on your school. So most often what we see is that you can just start over in the term. Like, you can just take it again. That's most often what we see. You can take it again. If you are in a position where you have taken it again, some students, we get emails from, these are, disclaimer, not members. Some students we do get emails from, and they say, I failed, 3 times. Then you might not be able to re-enter your program again. If you have, have not passed that nursing term a consecutive number of times, then you might lose the ability to reapply for your program and get accepted back in. It happens. So if you fail out of your term, mostly what we see is the first one where you can just do it again. Oftentimes you can what's it called where you contest it? No, that's not the right word. You can
apply to or
have it like reevaluated or whatever.
Yeah.
What's the word? There's a word for it though. Can someone tell me when you like petition it or whatever, you know what I'm saying? So you can go to like the dean of the program or the whatever director of your nursing program, and you can petition that to have it reversed. Appeal. Thank you.
That's what I
would appeal it. Have it appealed. And so you can appeal that decision. Wednesday. There you go. Can't think of words. You can have the decision appealed, and sometimes we have seen it overturned for sure. So yeah, thank you, Allison. Appeal. Yes.
Appeal.
Yes. Sometimes you can have it overturned. So that is what you would want to do for sure originally. And then, just reapply to your program if they allow it and all those things. Basically, you just want to follow your school's procedure for what happens if you fail out of their program. That's it. Sound good?
Yeah. Great. Sounds good.
If you are a Nursing SOS member, though, we don't have that happen very often. And we have actually, this is so funny. Did you guys know that in our Nursing SOS membership community, we have a money back guarantee? So if you don't pass nursing school, if you follow our tips for studying and planning your time and you fail out of your program, we give you your money back.
Be sure to follow the tips though and just pass.
Be sure to follow the tips though and just pass.
That's the easier way forward. Is just follow the tips and pass.
But what I wanted to say is we've never had anybody get their ask for their money back ever, which is insane, right? So that's awesome. So it's helpful for people. Get on the wait list because I'm gonna help you. Don't worry about failing nursing school. I've got you. Let's do it. Let's do it. All right. Let's take another question.
Advice to calm.
Christina's getting a little sassy this morning. Advice to calm.
Calm down.
Oh, was that the question?
Advice to calm our nerves when going to clinical for the first time.
Advice to
woo-saw.
What's that?
Saw. I don't know if anyone's seen Bad Boys 2, but woo-saw.
I don't know what that is.
It was, yeah. It's a good movie.
So if you are starting clinical for the first time, man, is that an experience. Advice to calm your nerves. Don't drink coffee or caffeine. It's not going to help you. Just be as prepared as possible. Make sure that you plan out everything the night before, lay out your clothes and have your stuff ready, so you're not scrambling in the morning. Have your schedule ready to go. Have your, whatever paperwork for the clinical you need, have it ready. You want the morning to be as calm as possible, right? I remember my first clinical day. I've told this story many times, your first clinical rotation in nursing school is going to be very heavily focused on the head to toe assessment oftentimes. And it took me a whole day to get through one head to toe assessment with my patient. She was so nice and I loved her. And she was just the sweetest. But, it just takes you forever to do everything because you don't know what you don't know. And, you just don't know. You don't know anything. And that's totally fine. Just know that you don't know anything. And that's totally fine. Nobody expects you to know everything right out of the gate.
Ask lots of questions.
Ask lots of questions.
Stuff I've heard.
Thank you.
Get things prepared. On that note, someone else was asking, what supplies, sheets, info do you suggest that they bring to their med-surg clinical? What supplies and sheets? I don't know what info do you suggest that they bring to med-surg clinical?
Yeah. So what supplies? You need your stethoscope, but you need all your clinical paperwork. So anything, let's see, what did I have in my, this would be a great video. Can you, Matthew, can you please write down for me, what to bring to a med-surg clinical? Would that be helpful for you guys? If I did a whole YouTube video on what to bring for a med-surg clinical? Because here's what I'm thinking. You definitely want a cheat sheet for SBAR. What is SBAR? You need your brain sheet for sure. Anything that will help you, write things down. Brain sheet. As for what else did I have? I had my clinical schedule. I had my care plans in my clinical notebook. Everyone's saying yes, perfect. I'd make care plans, like the paperwork that you need to do on your patients afterward for school. So this isn't like nursing, where nurses just go on the floor and then they leave. You know, they go on the floor and then they leave. They don't have to collect documentation throughout the day. Well, I mean, okay, yeah, nurses, you have to document stuff. But like for nursing students, it's a little different because you have to document and then you have to go home and write papers on your documentation. You see what I'm saying? So in nursing school, you have to make sure that you have all that paperwork with you, that you know what you need on your particular patient, you know, afterwards, to write your papers afterwards. So that's kind of the main paperwork. I also had an insulin cheat sheet. So if you go to nursingschoolofsuccess.com/sign up, nursingschoolofsuccess.com/sign up, print out the cheat sheet library that we have for you there. That's going to help you a lot. Keep all of those in your clinical notebook. Can you maybe post that link in the YouTube chat? Sure nursingschoolofsuccess.com/sign up, SIGNUP. We don't have it on the thing, but yeah, nursingschoolofsuccess.com/sign up. There's a whole cheat sheet library there for you to print out. So there's that. Stethoscope, obviously, a watch for sure. I had my, you need about 1,000 pens. I had my little pouch here. I like this one. Highlighters, pens, all the good stuff. I think that's just about covers it. Did I miss anything? I mean, obviously you need your scrubs and your uniform, pen light, you know, scissors if you want them, clamps if you want them, you know. Yeah, water, snacks, yeah. Lunch, lots of water. Can I see your pouch? Yes. I think I put this. Do we have a link to our Amazon shop?
We do not, but I do want to get that up because yes, we do have that. I think you
because this is in our Amazon shop.
Yeah.
For you to find. I don't know, because it took me forever to find it, to be honest with you. And so, I mean, I don't know. I think it's a Prestige Medical. Anyway, so once I found it, I put it in that Amazon shop for you. But now we don't have the link, so I'm sorry about that. Bummer. Oh, will you post this on the membership dashboard? We do not post the replays of the AMAs on the membership dashboard, no.
But
that's something to consider. We'll write that down as an idea.
YouTube's and get that. Are posting up the rest of the YouTube videos in the membership. So that's a good idea. Thank you.
Yep. So yeah, so there's the pouch. I think if you go to like Amazon and type in like nursing, what did I call this? What did they call this? Nursing fanny pack, nursing hip pack. Oh, I think it's a hip pack or like a hip pack. I don't know. Just go through your head. Yeah. nursing hip pack, something like that. Something akin to that effect. There you go. Yep.
All right. Let me see here. Going over here. Let's grab a couple more. Ooh. Do you have any ideas on how to best create pharm index cards or flashcards?
Oh yeah, good idea. Okay, yes. Actually, I know Nicole. So you guys, if you're a Nursing SMS member, you know that you can email us anytime and you will get a reply back from a nurse. So Nicole, our community manager, I know that she just responded to a member who had asked, what is an indication? Like, what is a medication indication? And an indication for a medication is just, what is it used for? Like, what's it used for? So let's do, this is a good one, heparin. This is actually Lovenox. Indications. Prevention of, DVT and VTE and PE. So pulmonary embolism, deep vein thrombosis, venous thromboembolism. So that's what heparin's for. So it's just the indications mean what is it used for? What is the medication used for? So when you are doing, I want to see if I have my drug. Let's see. Hang on one second. Christina's not organized. Let's jam on this, friends. I'm trying to find, because I don't have it here, our med card template for members. We have, oh, here it is. Okay, it's all beat up. Did you guys know that our 3-year-old comes in here and plays and colors on things? around here.
So don't mind the coloring if you see coloring
don't
on the
mind
sheets.
any coloring anywhere, you know, what have you. Here's our med card template. Okay, I'm gonna hold it up. Can you guys, okay, can you screenshot this, please? So I'm gonna hold it up and hopefully you can see it and then screenshot it because it has all the information that you need to know. Can you see? Okay, Instagram and YouTube, I think you can see it. Facebook, sorry, it might be a little struggle. Okay, screenshot that. Can you screenshot that? Did we screenshot it? Okay, so hopefully you can see it. Okay, let's just go through it really quick. Generic name and the class. The pharmacologic class, preferably the therapeutic class will work. It's fine. Mechanism of action. The mechanism of action of the medication is how does it act in the body? What does it actually do? How does it act in the body? Indications, like we said, are what is it used for? What is the medication used to treat? Side effects, common and life-threatening. What are the common side effects that you would see with this medication? And now what we always say, so good. We got this from another nurse on our team. Oh, she's so great. She's actually a nurse practitioner. And how she teaches side effects is she says, make sure to think about what happens if the medication works too well in the body. If the medication works too well in the body, what would happen? And that is going to be a lot of your side effects. So as you're studying side effects, just think to yourself, what would happen if the medication works too well? That's where you'll get a lot of those. Then the nursing assessment. What are you going to assess for before, during, and after you give the medication? Contraindications. When would you not give the medication? Maternity, pediatrics. So any woman who is pregnant, so pregnancy and children are often contraindicated. Patient education and then notes. So what are you going to educate your patient on? Sorry, Instagram, we only have 1 hour for Instagram. So come on over to YouTube and we will continue this conversation if you are on Instagram. Sorry about that.
Take care. Bye.
So this medication template, this med card template is inside the Nursing SOS membership community. So if you are a member, make sure to check it out. It is under the pharmacology course. And so it is there for you. There we go. Med template. And then also on YouTube, can we
med cards? Something like that?
Yeah, med cards. We have a whole YouTube video on med cards. There it is. Post that one up, babe.
Oh no.
Do it.
My cursor. Okay.
So our 3-year-old. This is the best. Our 3-year-old. We'll call him babe.
Hey babe. Hey babe.
He like walks you out house. Hey babe. Because I'm always calling him babe. And so he latched onto that. So he'll be like wandering around the house. Hey babe. Can I have a cheese slice, please?
Why, of course you can.
Hey, babe. So funny. Oh, man. I tell you what. All right. So I hope that was helpful. Med cards. Yeah, hopefully you guys got that screenshot. And then up on YouTube in the chat, we posted that video there. Yeah, and then this hip pack. Heather, you're saying scrub belt bag. Scrub belt bag. So if you go to Amazon, try that. Scrub belt bag. I don't know. You're looking for something like this. And then also probably what we'll do is on the replay of this YouTube video, we will post in the description our Amazon shop.
Oh, sure. Yeah.
We can do that.
Yeah.
We can do that.
Yeah, I guess I can.
Because I think it's in our Amazon shop.
Do that. I guess.
Sweet.
Okay.
Did Christina miss anything? Hey, quick question. Can you tell me, did you like the little mini lecture that I did on nursing textbooks? Was that helpful for you? Because typically what we do on these AMAs is we just answer questions the whole time. But I thought that it would be cool if I do a little, like, give you a little tip. And like, if I do a little mini, it's not a lecture, but like if I do a little mini, like, tip.
A little mini talk?
If I do a mini talk, was that helpful for you guys? Would you guys like to see more of like, for these AMAs, we could do, the majority of it obviously will be me answering your questions. But then also, I just wanted to make sure that you knew what textbooks were best to get. So, I don't know. I hope that was helpful.
All right.
Sounds good. All right, sweet, you guys. We'll see you on Monday. If you are wanting to ask a question for Monday, make sure that you head on over to YouTube. I will post the video up for Monday. Actually, it's already up there.
Yeah, YouTube was having some technical difficulties, or I was having technical difficulties. One of us was having technical difficulties, so it should be up there though.
For Monday.
Yep, the next YouTube live scheduled for Monday. So if you're going to be available then and would like to ask a question, go ahead and ask it there. There were a lot of questions today as well, so we tried to get through as many as possible, but if not, I still have them here and we can get through a few more next Monday, so we shall see. There's a hole in Christina's mouth, so sometimes just coffee just falls out.
It really does.
It's fine.
It just is always,
Don't worry,
dropping things.
She's fine.
It's okay.
So anyway, we will get to some more questions on Monday.
Yep, make sure you post in the chat though, on the video on Monday so that we can see. You can post in the chat before we go live.
Yes.
So if you have questions that you want us to answer on Monday's live AMA, post them in the chat before we go live on Monday. So if something comes up in lecture class tomorrow, post in the chat tomorrow. It'll be there, and then we will see it when we go live on Monday. So, all right, friends.
All right.
Take care. We'll see you next week on Monday at 9 a.m. Pacific.
Have a good week.
Bye-bye.
Bye-bye.
Boop, 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 boop.